So welcome again.
Hello, everybody.
Yeah, so as you can see, we are actually on vacation.
How can they see? What's different?
All right, we're just on vacation, you know.
All right.
I want to discuss something interesting, and that's, do doctors want you to be sick? I've heard it many times. In fact, a few weeks ago, we were having a discussion in church about health and all that, and somebody came up. If people are not sick, how do doctors want to eat?
Really? So we are trying to make people sick so that we can
yes
have jobs.
Yeah, so you know, sometimes we talk about mechanics. There are some types of mechanics that they want, when they see something wrong with your car, they say, oh, leave that one alone, don't fix it, let's just fix this one he brought, so that in a few weeks that one is going to, so it can come back. So people tend to think,
or they go and tamper with what is even good so that it can come back.
Oh, so there are even some mechanics that are that bad to even tamper with something in your car so that you come back in a few weeks time. So people always think that there's a possibility that doctors are like that. In fact, you know, I don't think we've had that. There's something we're supposed to discuss about, you know, big pharma and all those kind of theories about why we don't have a cure for things like cancer. You don't have cure for some of those things because people are purposely ordering
the treatment
or
the
cures
for those things.
Yeah. So
there are even theories about vaccines and all of that. Okay.
Yeah. So we discussed that some other day. But now let's talk about whether doctors truly want you to be sick. Let me add this to spice it up. You know, people who sell coffins. You see some of them near main hospitals. You see them, you know, and they feel like maybe when they come to work each morning, they pray that God, let's have customers, meaning that God, let somebody
for people to die
so that they can buy coffee.
I actually saw a video recently about a man talking about the fact that doctors are not trained to heal people. They actually want you to be sick. That's the training. That's the training we get in medical school, so that people can keep
coming to the hospital.
I actually saw a video like that on social media. He was just talking. I was wondering what he was talking about.
Hello, this is absolutely false. Absolutely false. All right, so there are some things in life that you can't give just one answer to. I mean, because one thing is linked to the other, right? One thing is linked, but we are going to prove it to you in a particular way. And how you are going to understand is very simple. Let me give you this example. Have you seen the Federal Road Safety Corps on the roads? Have you seen them? You know, when the accidents on the roads, these are the people that go there to rescue people, you know, pull those. So do they want accidents to happen? They don't want accidents to happen. They don't. All right. So, but the fact that they don't, does that prevent accidents from happening? No.
Yeah.
So now, let's move to doctors. These statements we are making are general statements, right? So it doesn't mean that you cannot have a doctor that probably thinks that way, but the generality of doctors don't think that way. Doctors don't want you to be sick. All right, so we are going to use ourselves as examples. So I'll start with you. Do you want patients to be sick?
No.
I don't want patients to be sick.
I don't want anybody to be sick, because you know when I'm consulting, what's on my mind is easing the pain of that person. Like I should just have one superpower that eases all the pain of that person. Sometimes when I'm not able to reach the diagnosis, I don't even, sometimes you're consulting with a patient, you're finding it difficult to arrive at a diagnosis, not to talk of knowing what to treat. It bothers me. Makes me to want to go and research more about, sometimes I'm I've seen a patient and I go back to check, how can I help this patient? I don't want to be in that emotional state. You think I want to be in that emotional state? No. So I don't want people to be sick. In fact, when you enter my office, I want you to find solution to what you have brought.
Okay.
And less patience for us, less stress for us.
Yes. So we can actually dissect it multiple layers. And we are going to prove it to you. So don't be in a hurry. We are just going to prove. It's not just about us saying this. She has said that personally, she likes it that the patient comes and you find a solution. Okay? But it doesn't mean that she wants you to be sick. Right? So there's a difference. There's something that Jesus said. The poor he will always have around you. Does it mean he wants you to be poor?
No.
So it just lets you know that the sick will always be there. Not because we want them to be sick.
Of which these medical professionals themselves, doctors, nurses, lab scientists, they fall sick. Don't we fall sick?
Doctors do fall sick.
I was ill about, was it 2 weeks ago? I was ill for 1 week.
So doctors fall sick. So for you to think that a doctor is, I don't get to my office and I'm like, God, today, let people fall sick so that I can see. So that I don't, I'm a surgeon. So I don't sit down in my office and say, God, let some people just have breast cancer now so that they can come to me.
No.
Once you see anybody that thinks like that person is not a doctor anymore. That person is not a doctor anymore. Because we see the harm, we see how these things ravage people. If you walk on the problem is that many people don't even know what's happening within the four walls of an hospital. I once had a patient who had breast cancer and she's like, why me? Those kind of questions. By the time she started her treatment and she saw many other people with the same problem, she stopped saying why me. She started being grateful that thank God mine is not as bad. In fact, she came and told me that, doctor, that place you sent me to for this treatment, I saw people lying down. I saw, it's as if I was the one that was the fittest. And I said, yes, because you took your treatment earlier. So when we see those things, there are many people that work on oncology wards and they are depressed because of the kind of bad cases they are seeing. So how can you now think that that person wants that thing to continue because you think the person is making money from that? In
fact, doctors, in terms of mental states, depression, anxiety, burnout, and all of that, being a doctor is top on that list. Is one of the occupations that ranks highest on the list, or on the list of professions that have the highest mental issues. And that's because of the things that we see on a day-to-day basis. Nobody wants anybody to be sick, but so things will just happen, and there must be people who are trained to take care of it. It's just part of life. Some things are just part of life. It happens.
Yeah. Now I'll give you another example. We have the younger doctors. You are in a clinic and you see 200 people waiting outside to be seen by the doctor. Those younger doctors don't want patients to. They don't. In fact, they come to work and they are praying, God, don't let me have many patients.
Exactly. Now, let me tell you, we recently concluded an outreach program, and on one of those days, we ran the outreach programs. We're still running the main clinic of the hospital, and then there was the outreach program for those that came for a religious or spiritual program. So we ran that outreach based on volunteer doctors. Yeah. So on one of the days, and I was the lead of the team, in quote, lead of the team. So on one of the days, after the major spiritual event precisely on the Saturday, I was the only doctor that saw myself, because the other doctors were tired. They went for an overnight program, so coming in the morning was a little difficult. So I was the only one there. When I got there and I saw the number of people already waiting, I said, I don't think I will be able to hold this and do this alone. I was really, because I was tired, I was fagged out, I was almost burnt out, and then coming there, seeing myself alone and the large crowd. I cannot imagine if when you face that on a day to day. It's just so nobody wants anybody to be sick. It's just a fact.
So the younger doctors, you ask them, how many do you want the clinic to be full of patients? The basic answer is no. I mean, the answer is just no. There's no coating it. You don't need to sugarcoat it or anything. They don't say, oh, I want to have many patients so I can make more money. It's not true. You don't make more money by having so many more patients, because you know why? Many of those patients don't even have money.
I was going to say that in our climb, many more patients does not translate to much more money, because many of those ones coming, they don't have money. And it will add to, there's something called job satisfaction. If you see a patient, and I'm sure it happens to every good doctor, if you see a patient and you are not able to help that patient, there's something that happens to you. You feel somehow. Like maybe by virtue of the person doesn't have money, or you are short-staffed, or you're this, and you know that I could have helped this person, but somehow you had to let the person go due to some circumstances. It weighs even on the doctor. So many more patients doesn't translate to much more money. In our climb.
So I think we have already proven that, generally speaking, doctors, younger and older, don't want patients to be sick because sickness is bad. Now, the next point I'm going to make has to do with hospital owners and business people. This is where there may be a little bit of a challenge, because you see, somebody who establishes a hospital just for purposes of making profit will want a lot of patients, right? But now there's a difference. That person is just a businessman. If the person is just a businessman, he may say, well, he may have that kind of thought process, but that is not a doctor. So we must learn to separate them. There's a difference between somebody being a businessman and somebody being a doctor. So when we talk about whether doctors want people to be sick, no, doctors don't want it to be sick. Maybe the businessmen who don't take care of patients, who don't know what it takes for somebody to be ill, somebody who is lively to just become on the bed, cannot do anything. Maybe those people don't understand what it means for patients to be sick. Maybe they may want patients to be sick. But for the doctor, no, you don't want patients to be sick.
Now, the flip side, I want to talk about the flip side of it, because people may think that, may have this entitlement mentality now, that if truly you don't want me to be sick, then when I come to you sick, you just must find solution to the challenge. Now, every healthcare is expensive anywhere in the world. Now, if you're seeing someone who has access to free medical service, it is paid for by someone. Now, so if you have enjoyed free medical service somewhere, that medical service was paid for by someone, whether it's your insurance service, whether someone has donated to the cause or something. So sometimes when you come to the hospital and you're expecting that something should be done for you for free, don't you have a human feeling? If you truly want to help me, why don't you do this for free? Remember that resources have been put into and if everything is done like that for free, that hospital will soon close down.
Now, so there are two things or three other things we're going to discuss before we round up the video. Now, this is what the real truth is. As doctors, we want. The truth is, I want to see sick patients, right? Get it right. If you are sick, I want you to come and see me so that I can find a solution to your problem. But I don't want you to be sick.
There are two different things.
So all I can pray for is for people who are sick
to find
a good doctor. I mean, so I don't want you to go to a quack when you are sick. I will pray that, let this person come to me or some other good doctor to find a solution to their problem. So I see a pregnant woman that I don't even know. I will pray that even though I'm not an obstetrician, I want that pregnant woman to find proper care with a good obstetrician. I don't want that woman finding herself in the wrong hands and then developing complications.
Yes.
I just told a story of a woman who had surgery and something was forgotten in her abdomen. I don't sit down here and pray that God, let somebody else who is doing surgery forget something in someone else's abdomen
so that
I can then take it out.
No, it doesn't work that way.
It doesn't work that way. That would be very callous. However, if a patient develops a complication, I will say, bring the patient to me so I can sort out that complication. You can see the difference.
Yeah. Now, the world is also moving for you to understand that
I know what you want to say. That was exactly where I was coming to.
Health systems don't want people to be sick. Their preventive health is being
Preventive health is the next thing I wanted to talk about.
Preventive health. When we talk about lifestyle medicine, what are we talking about? Prevention.
Yeah.
If we are talking about immunization, vaccination, getting immunized, preventive health. So you get a TB vaccine for your children, get chicken pox vaccine for your children. Why are we advocating for that? So that they don't come down with those illnesses. Preventive health. So if anybody really wants you to be sick, are they going to be advocating for preventive health? So eat good food, exercise, sleep well, so that you don't come down with chronic illnesses. Preventive health. So the world also is shifting towards, because it's even cheaper for people. If people are healthy, it's cheaper. It's cheaper for the government. The quality of life of people is better. Their work productivity is better, and the likes.
So the point with prevention is that if you are not sick, we've made the first point. Doctors don't pray that you should be sick. If you are sick, we want to take care of you. However, remember, if you are not sick, it doesn't prevent the doctor from living well. Don't get it right. Don't get it wrong. Don't think that the doctor is living well because you are sick. No,
that's the wrong way to think about it.
Even if we switch most doctors to prevention, it doesn't mean we are not going to have money again. We'll still have money.
Because prevention, you need the right knowledge to prevent illnesses. And even if you have the right knowledge, you need the right motivation to do those preventive stuff, and we will still make our money.
Now look at it like this. You see countries where they have very good roads, everything is beautiful, the roads last long, you maintain the roads. It's wrong for you. So are you going to say the people that construct those roads are not happy that the roads are lasting long? The roads are there for 10-15 years. They want roads that will be destroyed in 5 years. No. There are too many things to be done. You see, there's a lot to be done even in maintaining your roads. You will still make your money. You don't say Boeing wants their airplane to crash so that they can make more airplanes.
I like that one. I like that analogy. So
yes.
So they want to put one problem
on the air
so that the plane can crash.
Then they will say
they will not buy a new plane.
They will not buy a new plane.
Doesn't make sense.
Please, let's be guided in our thoughts. Let's not just make statements, just out of the blues like, no. Think about it. Interact with these doctors and see the way they think. When you see a patient who is hypertensive and you say you don't have a cure for it, and the patient has to continue using medication, and some patients want to stop their medication, because I know this is where some of those problems come from. You feel like the doctor wants you to keep coming back for medication.
That's why they are giving you medication.
We do not claim to cure what we cannot cure. When we can cure it, we tell you we can cure
it's those quacks that will tell you we can cure. We can cure. We will tell you plainly our limitations. See, this drug, this is the limitation, the adverse effect. But people want something that is absolute. People want something that is out of this world. But if you are telling them the truth, they will just probably think it's because the person wants me to come back. It doesn't work that way. Now, as a bonus, would wrap up this video by giving you the different levels of prevention. Now we talk about primary prevention. Yeah, in fact, we start with primordial prevention. There's no risk at all. We don't even want you to have risk factors that will lead you into having any form of illness. So avoid the risk factors. So eat healthy, don't smoke, and all of that. Now the other one is primary prevention, having the right access to information, immunization, drinking good water, health education like we're giving you now, so that you have the right information that will help you to live better in your health. And then we have the secondary prevention. That means that's early recognition of diseases in their early state, which is a form of prevention too. So if something is identified in its early state before it becomes so bad, it is better for you. So screening, check your blood sugar, check your blood pressure, all those things are very important based on your age, your sex, your occupation. There are different things that you can screen for early detection and prevention. And if those things are identified, they can be treated early, and then for those who need treatment, using your medications is a form of prevention too. For example, someone with diabetes, if you want to prevent the complication of loss of eyesight, stroke, kidney problems, you need to use your medications. That's another level of prevention. So you see, we want you to live in good health. God bless you.